Thank you, Rhonda. That's much appreciated. I would like to now bring us into the eye. I'm going to give you a quick overview of macular degeneration, and then we will go on into prevention of macular degeneration, treatment, and research. I know that many of you know this. This is very basic for many of you, but I know that for some in the audience it may be new information. Sometimes it's just good to get it all in one piece. The macular degeneration really refers to a condition of the retina. The macula is the very center of the retina, and the retina is the lining inside our eye. So, what is the normal retina? We can't see the retina from outside. We can see the outside structures, the iris, the cornea, the pupil. We need to dilate your eye so that we can get that pupil enlarged and look inside. And we're looking inside a bowl. And that lining of the bowl is the retina. It's a very beautiful structure. It has this orange color that you can see. You may be able to see some of the blood vessels, a small, whiter, little bit white round area, that's the optic nerve. And in the very center is the macula. So for those of you who can see that red circle, we're zooming in onto the macula, the very center of the retina. And when you see pictures that we show you throughout the morning, if you see pictures of the retina, it's really just this central portion. It's the most important portion of the retina because that's where we have our fine vision and our central vision. So as many of you know, we divide macular degeneration into dry and wet. Dry macular degeneration on the top is the most common. 14 million people in America have dry macular degeneration. Many of them don't know it. It can be very mild, so that you would not have any change in your vision. But the picture on the right shows that we can see, with this arrow I'm showing you, some yellow spots. Those are called drusen, and those are the sign of macular degeneration. Some people have only a few drusen. Some people have hundreds of drusen. They can be large, they can be small, they can be a whole mixture. Those drusen themselves may not cause any change in vision. The wet macular degeneration, and again, remember we're talking about just that central area of the retina, the wet is when there is bleeding and leaking. And here my arrow shows you kind of a smudgy patch of red. That dark red is blood that's in and under the retina. Well, here's what happens. Patients start out with the dry macular degeneration. Again, a very common condition. You'll hear more about this as we go through the day. It can lead to a gradual decrease in vision over many, many years, maybe very, very mild change in vision, or the dry itself can become severe. So we can lose vision right in the center of our vision with the dry form. About 10% of patients with the dry, so not everybody, but 1 out of 10, would get the wet, would get that bleeding. So some of you have experienced that. Some of you have been through treatment. Some of you are at the end stage where the wet has already turned to perhaps scar tissue. So the 10% of people with dry can get the wet, and that typically leads to a fairly rapid change in vision. So again, one more thing to point out is that dry macular degeneration, you see on the left those drusen, those little yellow spots, can also lead to changes in your vision. Without bleeding, it can lead to atrophy or thinning. And the picture on the right shows some orange, it's hard to see, but some orange splotches in the center that actually represent thinning of the retina, or what we call atrophy. So we'll be discussing today the drusen, that early mild stage of dry macular degeneration. We'll be discussing wet macular degeneration when there's bleeding, and we'll be discussing the severe form of dry macular degeneration when there's retinal thinning. So in summary, the macular degeneration really boils down to these two types, two categories, dry and wet. Patients with the dry can be mild or severe. If you have mild macular degeneration, you still may have some vision problems. You may still have difficulty seeing at night. You may still find it hard to read unless letters are larger in print or dark in color. And you may find it hard to differentiate color. Those are all the effects of even the mild dry form. And then remember that patients can lose vision from the dry macular degeneration and the wet.